Thank you for your interest in the PGY1 or PGY2 residency programs at the Grand Island VA. We'd like to use this video to discuss some highlights of the program as well as answer some common questions we expect to receive. My name is Michelle Paulson. I'm a PGY1 resident that completed pharmacy school at Northeastern University in Boston. I'm from Grand Island, Nebraska.
Hi, I'm Kristen, one of the PGY1 residents here at the Grand Island VA.
Hi, my name is Jessica Berry, and I'm the current ambulatory care PGY2 resident at VA Nebraska Western Iowa Healthcare System. I attended pharmacy school at Drake University and completed my PGY1 residency at VA Central Iowa Healthcare System in Des Moines, Iowa.
The Grand Island VA is part of the Nebraska Western Iowa Healthcare System, which has other primary locations in Lincoln and Omaha, as well as several CBOCs or community-based outpatient clinics throughout Nebraska and Iowa.
One of my favorite things about this residency is the patient population. Within the VA, you will often hear how rewarding it is to serve those who have served. In my experience, this phrase definitely holds true. I consider myself so lucky to work with such a kind and deserving patient population who makes me smile every day. Their courage, sacrifice, and selflessness are just a few of the reasons I look up to this group.
The Nebraska Western Iowa Healthcare System offers a diverse experience ranging from ambulatory care, mental health, management, acute care, academia, and more.
There were a few different things that drew me to this residency program. First, I completed my PGY1 residency in the VA and knew I wanted to stay in the system due to the collaborative, friendly, and progressive environment.
While I didn't have VA experience prior to residency, I've really enjoyed the opportunity to serve those who have served our country. The rotations offered throughout the PGY1 year aligned with my broad interests in ambulatory care, mental health, and hospice or palliative care.
My goal is to be a clinical pharmacist in an ambulatory care setting, so the VA NWI healthcare system caught my attention with its ample opportunity for ambulatory care rotations. I also wanted at least one or two co-residents, and in Grand Island there are 2 PGY1 residents and 1 PGY2 resident. We're also lucky to have 6 other PGY1 co-residents between the Omaha and Lincoln VA campuses.
I liked how the PGY2 program was multi-site, meaning I could complete electives at the Omaha and Lincoln VA campuses. This year, I really enjoyed my time in the Omaha specialty clinics as I was able to work closely with medical residents, fellows, and attending physicians, which allowed me to gain a different perspective on clinical decision making. Lastly, I like that this was a newer program. I thought it was interesting to have the opportunity to help the program further develop and grow, thus setting the foundation for future residents.
PGY1 residents staff 20 to 25 hours per month for our longitudinal staffing component. We gain proficiency in both inpatient and outpatient order processing, dispensing, and verification. I truly enjoy my staffing days because the operations preceptors see you grow and improve throughout the entire year, and all the preceptors at the GIVA are extremely supportive.
Staffing is structured differently as a PGY2. The PGY2 resident does not have a formal staffing component but can apply for dual appointment through the VA. During dual appointment, residents earn pharmacist wages for their time working on processing pending prescriptions, completing therapeutic interchanges and conversions, and helping with any other pharmacy initiatives that may be going on at the time.
I feel supported by our program director here at the Grand Island VA. She's organized, open to our feedback, and always makes the time to precept us on rotations and with our projects. The preceptors and technicians are also supportive and ensure that the residents are given the necessary tools for success while here at the VA.
During my interview, I felt very comfortable and loved how personable and down-to-earth the staff were. I also knew that the preceptors at this site would push me to be the best pharmacist I could be.
During the interview process, I could tell that the Grand Island VA pharmacy team had a close-knit feel. They genuinely seemed interested in helping their residents succeed, not only during the residency year, but also in starting their careers.